Hello, I'm Dr. Sam Ginsberg and I'm a retired psychologist, which makes me quite old, but I've learned something along the way. I'm a patron of Hands on Health Australia, which is a wonderful organisation. I was there right at the start of Hands on Health, so it's been a beautiful journey over many years. I want to talk today in this series on mental health and how we can be happier and stronger when we face this pandemic, about moods and feelings and emotions. Now, there's a bit of a saying that us psychologists use and say how we think has a huge impact on how we feel. And that's very important. Our thinking, if it is positive, if it is reflective, if we're thinking about what we can do rather than what we can't do, we will feel much better. We'll feel more in control. You know the sense yourself when you feel trapped in something. It can be a big challenge to really lift your spirit. So please keep in mind how you think. Now, if you think about what you can do, and if you realise that probably planning and organising what you do puts you in control. So what are some of the things that you can do? Well, some of the things I do, and also some of my friends do, when we go for a walk, for example, we talk to our friends and neighbours, people in the street. We keep our social distance and we have our mask on, but we talk to people and respond. And the emotions have a lot to do with the face and particularly the eyes. So the mask covers the mouth, but it doesn't cover the eyes and it doesn't stop the movement of the hands and the head. So you can relate to people. And that's really, really important. There's a nice saying in psychology that the door to happiness opens outwards. And that means going out to other people. So how can you go out to other people apart from greeting and being warm and friendly, which is very important? Well, if you have neighbours and who are convenient across the road or next door to you, you can put a note in their letterbox, something to cheer them up. Or if you're cooking, you can make a little bit extra and you can put a plate on their doorstep. There are many, many things you can do for other people, and we all feel better, not only when we do things for ourselves, but particularly for other people. It's about the fact that we're gregarious and we want to interact, be creative. There are many ways of doing this. So I look forward to speaking to you next time, but see if you can lift the emotions by being happy and looking and thinking not only for yourself, but for other people. They're struggling. There's a bit of a thing in this pandemic that we're asked to stay at home. If you get the attitude that you're genuinely helping family and friends, all the medical and other people say, please stay at home, you're actually helping people. You're helping people not to get sick, and particularly the older people amongst us, although it also affects younger people. So if you're staying at home, you're doing a wonderful thing for the community, and keep that in mind. It's true. And I'll just end with my little spiel about stay healthy, stay positive, stay active. Okay, a little reminder just at the end of this session. If you're with someone and you're concerned about them, you can ask them, are you okay? If they express concern, you could recommend to them that they ring LIFELINE. The sort of things that you might be very concerned about would be if people are sleepless, not eating well, very tearful, anything like that. And you might share your concerns about yourself as well, and that will help them to speak.